I would like to share my inguinal hernia journey and my experience with the surgery, laparoscopic surgery, and what is hernia, how it happened, and the surgery process. About 11 months ago, I had a UTI, urinary tract infection, and I went to the local general GP doctor, and I was given antibiotics for the UTI. At the bottom of my body, it started to swell. There was a swelling at the bottom of my body, right side. And at first, we thought it was a kidney issue. There was some kidney pain. So, given the antibiotic, hopefully it will go away. But a month later, about 10 months ago, a month later, the swelling appears again. And it started to feel a bit uncomfortable. So I decided to go to a UTI specialist in a Inguinal Thong hospital. So during the doctor visit, the doctor examined me and found that it was not a UTI infection. It's actually a possible hernia, inguinal hernia. So the doctor arranged for a scan to confirm whether it's a hernia. So what is hernia? Hernia is basically where it can happen in many parts of your body. But for men, mostly it's either at the left or the right side bottom of your tummy. And for my case, it's at the bottom of my tummy, right side. Basically, there's a hole in the tissue holding the intestine. This hole is where the colon, the intestines, is protruding out through the hole. And this forms a swelling on the surface of my body. If this is not treated, the colon or the intestine may suffocate and die, and there could be implication. So for that reason, I decided to go with my hernia surgery. And in Singapore, we do have laparoscopic surgery versus a direct cut in the hernia location. So I've chosen the laparoscopic surgery. Three things I found quite interesting about the surgery process. The first one is anesthesia. There are three types. There is a sedation, there is a regional anesthesia applied, or there's a general anesthesia. For my case, I will be having a general anesthesia. And the interesting part about it is that they will insert an instrument through the keyhole, and there will be gas that will be pumped into the tummy to have a space for the surgery. So this bloating of the tummy will result later in some pain after the surgery. So this is an interesting part of it, that finding during my research. The gas is pumped into my tummy. The second thing that I found was the general anesthesia process. During the general anesthesia, the anesthesia doctor will basically intubate my airway where they will insert a hose through my airway down to the lung. And they will have a balloon blown to block any gastric juice coming into my lung. Because during the general anesthesia, your mind is sleeping. You no longer controlling your airway and controlling your breathing responses. So there will be machines that will monitor my breathing process and making sure that I'm breathing normally through the machine. So that's the second thing that I found, was there will be a tube inserted into my airway, into my lung, to help me to breathe. The third interesting point about this process is the waking up from anesthesia. My mind after surgery will be blank, and during the waking up process, the tube is still inside my airway. So when I come out from my anesthesia influence, the doctor wanted to see my reaction, my body reaction, because if they were to remove the tube out earlier before waking up, and if there's an emergency that they have to put in the tube again, it is going to be an emergency process. So it's better that they monitor my waking up process with the tube in, for me to have the choking, coughing process, and then waking up, and then removing the tube. So this is quite interesting, or scary. So today is the day before my surgery. So I'll be doing my fasting, making sure that my bowels are cleared. So tomorrow I'll be reporting to the Woon Yew Thong Hospital at 7 a.m., going through the anesthesia process, and the surgery will start at 8:30. And hopefully, if there's no complication, I should be discharged 4 or 5 hours later, maybe in the early afternoon. But due to my age and due to my lymphoma cancer, they may want to admit me to the hospital for one night to observe, for observation. So we'll see how. So tomorrow, after my surgery, I will give an update on the process and also how I'm feeling after day 1 of the surgery.
Just came back from the operating theater very fast. So before surgery, the anesthesia applied the drugs, and I was out very quickly, no feeling, and I was back to the ward now for observation. Feeling a bit thirsty, and throat is okay. The feeling a bit uncomfortable on the bottom right hand side. So the surgery was done. I see 3 holes. 1, 2, 3. Tummy is looks like a bit bloated, but I think it's okay. No pain. So quite alert actually. I'm a bit alert. Now they are measuring observation. 5 hours from the surgery. Still okay. A bit of sore throat and a bit tummy pain on the right side.
We only pump air over this part lah. So anyway, everything went well. It was very smooth. We put in the mesh already. So you managed to pass urine already?
Yes, many times.
Many times. Okay, eat already?
Yeah, twice.
Okay, excellent. Then I think you're ready for home lah.
Hi, I'm back. This is day 1 of my surgery report update. I admitted to the hospital at 7 a.m. and I was brought into a waiting room to change my clothes. So I was assigned a bed in the patient care observation ward, and so they allowed me to change my clothes to the gown, and shortly I was wheeled to the anesthesia room. The anesthesia room was very well maintained and managed. The people are very professional, so they assure me that the anesthesia will be okay. I was a bit nervous about the anesthesia process because my breathing will be under the control of a machine, not by my brain activity. So the anesthesia doctor put in a syringe onto my nerve, my vein, and next thing I know is I was wheeled to the surgery room. I was transferred to the small surgery bed, and the nurses were putting in a warmer to make me sure blankets, so I'm making sure I'm warm, and the anesthesia doctor start to apply the drugs in, and I was opening my eye, and the next moment I'm gone. So 3 hours later, the operation took 1.5 hours. So 3 hours later, around 12 noon, I felt the nurse waking me up, and to my surprise, I was pretty well alert, very little pain, and even my the tube in my mouth to the lung was even taken out. So I did not feel anything. So I just woke up happily and alert, and so the nurse said, okay, put me to the observation ward. So back to observation ward by 12 something, by 1 o'clock. So I was sitting well, no pain, and of course due to the painkiller. I'm sure I'm feeling good because of the painkiller. And since the doctors were busy with her operation surgery, so they cannot approve my discharge from the hospital. One thing I noticed once I'm in the observation ward, as the painkiller wear off, I did start to feel the pain on my bottom right hand side of the body, and then I noticed that passing urine is becoming difficult. My first try was not easy. One of the reasons why I drank a lot of water is to try and pass urine more. So because one of the criteria to discharge from the hospital is to make sure that you can pass urine. Of course, I did not tell the doctor or the nurse that I have difficulty in passing. So I tried the first time a little bit, second try a bit more, and the third try a bit more. But it's still not very good. I noticed that passing urine is quite difficult for the full urine flow. About 4 to 5 p.m. day 1, because of the pain on the hernia area, seems like my bladder is constantly irritated and constantly wanted to pass urine. Even though I have not much urine, it continues to keep me busy going to the toilet, to the washroom several times a day, every hour. So that's not I'm not sure, maybe it is a side effect of the surgery. By the time the doctor came, it was about 7 p.m. So doctor said I'm okay, I can pass urine, no pain. I told her I hardly have any much pain, so I was discharged. So now I'm back home. The hoarse voice that you're hearing right now is that it appears about 3 hours after waking up. I felt the tube that was inside my throat taken out, somehow affected my airway, and it's causing some mucus on the throat. So speaking is a bit hard. I was able to walk slowly, step by step, and squatting down is painful. Update on day 3. This morning, could not sleep well because of the pain inside my body. I could feel that the tissues inside that was cut during surgery is causing some pain. So 3 a.m. could not take the pain anymore, so I took 2 Panadols. Hopefully that actually reduced the pain and managed to get some sleep. One of the biggest issue that I encountered on day 3 is the constipation. So for the last 3 days, there was not much bowel movement, very difficult to pass motion. So luckily yesterday, I bought some constipation pills and took them. So this morning, managed to have some bowel movement, which is a big relief. In terms of walking around the house, I'm now walking quite normal. So the pain is not there when during the walking process. So pretty good. Day 4 of my update. This morning, I had no pain, so I did not take any Panadol or painkiller pills in the middle of the night. So I slept well, and the pain in the surgery area is no longer there. So feeling much better. I did manage to go out for a walk, about 1 kilometer. So walking slowly, and I could feel there's a mesh in my body. So I'm worried that if I twist too much, the mesh and the bonding between the mesh and the skin inside may become loose or loosen. So I had to be very careful. In terms of the laparoscopic holes that I have, the 3 holes, there are some itchiness. So I'm not sure how to deal with that. It's a bit itchy. So I guess maybe by tomorrow, hopefully it will be better. Update on my day 5 and day 6. Sleeping over the last 2 nights is okay. Getting up the bed is still a bit slightly uncomfortable, especially when getting up the bed, sitting upright. The 3 holes, the 3 laparoscopic holes, still have some itching. So I think it's important to wear loose pants and not to aggravate the 3 incisions, the 3 holes incision, so that it can heal properly. I need to understand or ask the doctor later maybe why it start to itch and whether there's any medication to reduce the itchiness. Walking is okay, walking slowly. So try not to run, but walking slowly is fine. I can still feel the mesh in the body. So it's slightly a bit uncomfortable if you are walking too fast. Constipation is over, so I'm having regular bowel movement, so that is good. In summary, day 1 to day 3 is the most critical period. Make sure that you do take the painkillers, because that will help a lot in your sleep. So first, day 1 to day 3, you should take painkillers, and do watch out for the constipation on day 1 and 2. So do buy the constipation pill, where it can help you to have regular bowel movement.